had traditional gum surgery many years ago, and what they do is they cut your gums, they roll your gums back, clean your gums, and then they stitch it back together, which is not very comfortable, very painful, not a very good experience. And with periodontal issues, like I have gum issues, they have to do that every couple of years. I was due for a second gum cleaning the traditional way, which I wasn't looking forward to. I got a little postcard in the mail that said this new thing that was out was a LANAP, and it explained what was going on with it, and I was like, oh, this kind of sounds different, so maybe I should come talk to the dentist and see what's going on there. I would recommend LANAP because they don't cut your gums. It's a laser treatment that's not very painful at all. The recovery was a piece of cake. It's like night and day. The best thing about LANAP is it's a one and done most of the time, for me at least anyway. You know, if it gets worse, then I may have to get touch-up treatment, but I've had it like 10 years ago and I haven't been back to do anything with my gums. My gums have been great since. There wasn't really any post-op kind of things, just, you know, it was a little tender in the beginning, but that went away pretty quickly. And then it was just maintain, you know, your brushing and keeping your teeth clean and stuff like that. What I did do is I got the Invisalign to help straighten my teeth and tighten my gums a little more, so that would help with the LANAP. So it was kind of an extra on top of that. So that really tightened everything up for me. So I used to have pockets of, you know, 15 millimeters, 14 millimeters. They're like 2 and 3 now. It was a 15, maybe 16 millimeter pocket, and the tooth was so loose you could almost pull it out with your fingers. And the dentist, Dr. Stewart here, he said no, he wanted to save that tooth. That was his goal, to save that tooth. So with LANAP, that tightened up the pockets. He made sure everything was secure in there, and with the Invisalign on top of that to tighten everything up, I think the pocket now is like a 5, and the tooth is still there. So it saved that tooth, and it's good to go. There's no way you can pull it out now with your fingers, where before you could pull it out with your fingers. Definitely recommend LANAP for anybody who has periodontal problems, needs gum cleaning. It by far beats the traditional way of doing the gum cleaning. I would not go back and do that ever again. LANAP is by far the easier, less painful way of doing it.